There's a lot of talk about this year's flu virus on the local health front right now, and the nurse practitioners at CVS Minute Clinic are adding to that conversation. Here's this week's What's Going Around.
In central San Diego, a reminder about staying up to date on your vaccines. Gretchen Broman in Claremont says pharmacies are stocked with this year's flu shot, and now is a great time to get one. Common side effects may include pain, redness, and some swelling at the injection site. The shot is recommended for anyone 6 months of age and older. A nasty cold infection is making the rounds in East San Diego, and Kate Fitzgerald in El Cajon says it's left some of her patients with a serious ear infection. This is the result of fluid buildup in your inner ear. Symptoms include pressure, muffled hearing, and a feeling of being underwater. It can take days or even weeks for the fluid to drain, but anti-inflammatories and other over-the-counter medications may help. And in South San Diego, a different kind of flu, Becky Carroll in Chula Vista has diagnosed a number of cases of viral gastroenteritis, also known as the stomach flu. This illness is spread by contaminated food or sharing utensils. Symptoms include stomach pain, nausea, vomiting, diarrhea, and fever. Treatment should focus on staying hydrated. This should include sports drinks with electrolytes and drink small amounts at regular intervals. If you're unable to tolerate any food or liquid, you should seek medical attention. And in North San Diego, skin issues. Agnes Sato in La Jolla has been seeing patients with Paronychia. This is an acute skin infection of the nail folds or cuticles. The most common cause is bacterial, but it can also be the result of fungus. Symptoms include acute onset of pain, redness and swelling around the nail, and pus. Treatment includes soaking the finger in warm water and applying topical antibiotics. And that does it for this week's What's Going Around.